Just before I call the Secretary of State, I would like to say, Secretary of State and myself did have a conversation in a meeting last night. Just to say, I think we've got some new arrangements going forward to help the House. I now call Secretary of State Matt Hancock to make a statement.
Thank you very much, Mr. Speaker. And just to concur with what you said there, I do regard it as incredibly important to come to the House as often as possible. Sometimes these are fast-moving situations, and I will ensure that I give the House its full attention, and as I try to do, answer as many questions as fully as I can. With permission, I'd like to make a further statement on coronavirus. We've done much as a nation to get this virus under control, and so we've been able to restore so much. Just one example, figures today show that radiotherapy services in England have now returned to pre-pandemic levels, and this is good news and will save lives. But as I said to the House on Tuesday, we are seeing some concerning trends, including an increase in the number of positive cases, especially, but not only, amongst younger people. As the Chief Medical Officer said yesterday, we must learn from the recent experience of countries like Belgium, who successfully put in place measures to combat a similar rise in infections. And so today, Mr. Speaker, I'd like to update the House on a number of new measures that will help us to get this virus under control, to make the rules clearer, simpler, and more enforceable. First, Mr. Speaker, we're putting in place new rules on social contact. We've listened to feedback from the public and the police, and we're simplifying and strengthening the rules, making them easier to understand and easier to enforce. In England, from Monday, we're introducing the rule of 6. Nobody should meet socially in groups of more than 6, and if you do, you will be breaking the law. This will apply in any setting, indoors or outdoors, at home or in the pub. It replaces both the existing ban on gatherings of more than 30 and the current guidance on allowing 2 households to meet indoors. There will be some exemptions. For example, if a single household or support bubble is larger than 6, they can still gather. Places of education and work are unaffected. COVID-secure weddings, wedding receptions, and funerals can go ahead up to a limit of 30 people. Organised sport and exercise is exempt. Mr. Speaker, these are not measures that we take lightly. I understand that for many, they'll mean changing long-awaited plans or missing out on precious moments with loved ones. But this sacrifice is vital to control the virus for the long term and save lives. And I vow that we will not keep these rules in place for any longer than we have to. Second, Mr. Speaker, we're putting in place stronger enforcement. Hospitality venues will be legally required to request the contact details of every party. They'll have to record and retain these details for 21 days and provide them to NHS Test and Trace without delay when required. This system is working well voluntarily with minimal friction, and it's very effective, but it isn't in place in all venues, and so it's only fair that it's followed by all. We're supporting local authorities to make greater use of their powers to close venues that are breaking rules and pose a risk to public health, and fines will be levied against hospitality venues that fail to ensure their premises are COVID secure. Mr. Speaker, our goal as much as possible is to protect keeping schools and businesses open whilst controlling the virus. The data show that while the cases amongst 17 to 30-year-olds are rising, the number of cases amongst the under-16s remain very low. And we all know how important it is to keep schools open. As the Chief Medical Officers have said, the long-term risks to children's life chances of not going to school are significant and far greater than the health risks of going back to school. The latest data confirm this. And of course, university students will soon be returning. The Department for Education has published the updated guidance for universities on how they can operate in a COVID-secure way. This includes a clear request not to send students home in the event of an outbreak in order to avoid spreading the virus further across the country. If you're a student who's about to return to university or go to university for the first time, then please, for the sake of your education and your parents' and grandparents' health, follow the rules and don't gather in groups of more than 6. Mr. Speaker, our ability to test and trace on a large scale is also fundamental to controlling the virus, as we've discussed in this House many times. The latest data shows that we're doing more testing per head than other European countries like Germany and Spain, and we have record capacity. We've increased capacity by over 10,000 tests a day over the last fortnight. And while there have been challenges in access to tests, the vast majority of people get their tests rapidly and close to home. The average distance travelled to a test site is 6.4 miles, and 90% of people who book a test travel 22 miles or less. We already have more than 400 testing sites in operation. We added 19 last week and plan 17 more this week. However, as capacity has increased, we've seen an even faster rise in demand, including a significant increase from people who do not have symptoms and are not eligible for a test. This takes tests away from people who need them. So if you have symptoms of coronavirus or are asked by a clinician or local authority to get a test, then please apply. But if you do not have symptoms and haven't been asked, then you are not eligible for a test. At the same time, we're developing new types of tests which are simple, quick, and scalable. They use swabs or saliva. They can be turned around in 90 minutes or even 20 minutes. The so-called Operation Moonshot to deploy mass testing will allow people to lead more normal lives and reduce the need for social distancing. For instance, it could mean theatres and sports venues could test audience members on the day and let in those with a negative result. Workplaces could be opened up to all those who test negative that morning. And anyone isolating because they are a contact or quarantining after travelling abroad could be tested and released. We're piloting this approach right now and verifying the new technology. Then it can be rolled out nationwide. And Mr. Speaker, I'm going to depart from my script here because I've heard the naysayers before, and I've heard the people on the other side complain we'll never get testing going. And they're the same old voices. The same old voices. They opposed the 100,000 tests. And did we deliver that? Yes, we did. They're saying, what about testing in care homes? Well, we delivered the tests to care homes earlier this week. They are against everything that's needed to sort this problem for this country, and they would do far better to support their constituents and get with the programme. And I'm looking forward to rolling out this programme and this work, which has been underway for some time already. I'm absolutely determined that we will get there. And if everything comes together, and if the technology comes off, it will be possible, even for challenging sectors like theatres, to get closer to normal before Christmas. Now, finally, Mr. Speaker, the most important thing that each and every one of us can do is to remember the small things that can make a big difference. Hands, face, space. And if you have symptoms, get a test. Hands, wash your hands regularly and for 20 seconds. Face, wear a face covering over your mouth and nose if you're in an enclosed space and in close contact with people you don't normally meet. Space. Always stay 2 meters away from people you don't live with, or 1 meter with extra precautions like extra ventilation, screens, or face coverings. And of course, if you have COVID symptoms, get a test and self-isolate. Mr. Speaker, coronavirus is a powerful adversary, and when called upon, the British people have done so much to blunt the force of this invisible killer. And now at this important juncture, we're being called upon once more to deliver our collective commitment to follow the rules and get this virus under control. And I commend this statement to the House.
Now call the Shadow Secretary of State, Jonathan Ashworth.
I am, as always, welcome and grateful for advance copy of the statement. And we welcome the restrictions that the government have imposed. And indeed, we would have welcomed them on Tuesday afternoon had he confirmed what was being said on Twitter that morning. We have seen in recent days that cases have risen sharply across all ages, and admissions to hospitals, sadly, are beginning to increase as well. We all want to avoid a second national lockdown. Lockdowns extract a heavy social, an economic price on those who are already suffering. And we should remember that today on World Suicide Prevention Day, we must remember the mental health impact of lockdowns as well. So can I ask him particularly, before I go into the substance of his remarks today, particularly about schools, because we've had many examples across the country of classes and year groups of hundreds, possibly thousands now, of pupils starting the new term as they finished the last term, at home and not in education. Is it really the policy of the government that if there are 1 or 2 positive cases in a year group, then the whole year group is sent home for 2 weeks? And if so, are parents and carers eligible for sick pay and financial support, given they will have to take time off work to look after their children? Now, Mr. Speaker, we were promised a world-beating test, trace and isolate regime by now. He says we've got one. Well, on Tuesday, I highlighted its performance in finding contacts and the deteriorating performance. He said on Tuesday I had muddled my figures. Full Fact said I was right and he was wrong, Mr. Speaker. So I will leave it to him to judge whether he wants to correct the record or not, but I would rather he just corrects test and trace. In one study, researchers have found that 75% of people with infections did not adhere with self-isolation. I know he is piloting extra support, but we need a system now, urgently, so that those who are low paid and in insecure work can isolate without fear of losing their jobs. We need a system immediately. We've been calling for it for months and months and months, as he knows. And on testing, I mean, he told us a few moments ago to get with the programme, Mr. Speaker. We just want him to deliver testing for our constituents, Mr. Speaker. We've had examples after examples of people being told to go hundreds of miles. In Telford, the borough has been gridlocked because the system has been telling everybody to go to Telford. And yesterday, he was touring TV studios trying to dampen demand, even though he previously told this House in July, this was his quote, "If you have symptoms, if in doubt, get a test." That's what, if in doubt. He was telling people to get tests, Mr. Speaker. So having encouraged people to get tests, and with 8 million pupils returning to school, with thousands going back to workplaces, as his Prime Minister has insisted upon, surely it was obvious there would be extra demand on the system, and why didn't he plan extra resource capacity to process tests? It isn't the fault of ill people asking for tests, Mr. Speaker. It's his fault for not providing them. And we had no apology today to our constituents who have been told to travel hundreds of miles for a test. And having failed to provide the tests that people need, and by the way, having failed to provide wider diagnostic tests, the waiting list for diagnostic tests has hit 1.2 million today. That's the highest on record. He now wants to deliver 10 million tests a day as part of his so-called Project Moonshot. Now, I've long been pushing him for a strategic mass testing regime from the start. The World Health Organization told us to test. But we are all fed up of undelivered promises and world-beating. Mass testing is too important to become another failed project. It's all well and good, him talking about moonshots and the Prime Minister telling us we'll be tested every morning. Even better would be simply delivering the extra testing that is needed now, not just headline figures. So I have some very specific questions. First of all, the Prime Minister told the nation he wants this in place by spring. The Chief Scientific Advisor pointed out it's completely wrong to assume this is a slam dunk that can definitely happen. So how quickly will this be delivered, and how quickly will the pilots in Salford and Southampton be assessed? Secondly, what is the cost? According to the British Medical Journal, leaked documents suggest the cost will be 100 billion. Is this correct? If it's not correct, can he tell us what his estimate is of the cost of processing 10 million tests a day? And can he tell us how much has been allocated to Project Moonshot? Thirdly, who will deliver it? There are universities piloting projects, like University of Leicester, who are rolling out LAMP testing. What discussions has he had with them? But it's reported that he has already signed agreements and understandings for this project with GSK, Serco and G4S to deliver this. What procurement processes have been undertaken, and can he tell us if that is correct? Fourthly, what are the priorities? He's still not testing the loved ones of care home residents who are desperate to see relatives. And when will the government actually deliver the routine testing of all frontline NHS staff that we've been demanding for months? Mr. Speaker, effective testing depends on quick turnaround and local access. It depends on effective contact tracing. Given he's not even been able to deliver these basics, how on earth do we expect him to deliver this moonshot?
Secretary of State.
Well, Mr. Speaker, I think that the honourable gentleman was rather better when he was supporting the government action in the first part of his response. And what I'd say to him is, he can't seem to decide whether he's in favour of more testing or whether he's against it. All we get is complaint after complaint rather than supporting his constituents and the people of this country in our quest to get through this virus. Firstly, on who is eligible for a test, precisely as I said and as he literally read out, if you have symptoms, get a test. But if you don't have symptoms, then you are not eligible for a test unless you've specifically been asked. And yes, if you have symptoms, and if you're in doubt of whether those symptoms are coronavirus or not, get a test. But if you don't have symptoms, don't get a test. It hasn't changed. It's exactly the same. What's changed is the honourable member opposite not knowing whether he's coming or going. And he doesn't seem to understand. He doesn't seem to understand that the way you build a huge project like our testing, which is at record levels, is that you back all the horses. He once again complained about businesses supporting us in our rollout of mass testing. Again, this divisive approach is wrong. We support universities to deliver more testing. We support businesses to deliver more testing. We support the NHS to deliver more testing. We don't support the totally confused approach on the benches opposite. He doesn't know whether he's in favour or against of more testing. He asked about the money. £500 million has thus far been allocated to this project, but it's likely that there will be more. And he asked about staff testing in the NHS, where, as he well knows, we follow clinical advice, but we always keep it under review. Finally, he asked about schools, and the policy on schools is that if somebody tests positive, then that bubble does need to self-isolate, and a bubble is defined by those who are in close contact within a school setting. I'd finally, though, like to end on a point on which we strongly agree. This World Suicide Prevention Day, all of us are united in our support for the mental health services that are provided across this country, and our support for all those who are working hard, for those who have mental ill health or who are at risk of suicide. It is a project on which all of us are on the same side and working together to support people.
Select Committee.
Mr. Speaker, as someone who has long campaigned for mass testing, I warmly welcome the ambition behind Operation Moonshot and the implied characterisation of the Health Secretary as this country's answer to Neil Armstrong. But 10 million is a huge target, and I wonder whether he could give the House some idea of the proportion of that 10 million that is dependent on new technologies and the proportion that we can get to with existing technologies, because mass testing is so important to getting the country back to running as normal. And whilst we all want those new technologies to succeed, it will be helpful to have an understanding of how much expansion we can expect on the technologies we already have.
That is an extremely clear and strong position from the chair of the Select Committee. Of course, we're expanding the current technologies. We have a plan, and we're on track for this plan to get to 500,000 tests a day by the end of the next month on the current technologies. On the next generation of technologies, I'm not going to put a figure on it because it depends on the technologies coming off. And the very nature of backing new technologies is that you don't know which ones are going to be verified. This is why we've got so many that are being piloted, so many with whom we're working. We have tests right now in Porton Down being verified. We want this to go as fast as we can. We want this to go as large as we reasonably can, but we do not put a specific figure on it. what we do is put all of our weight and support behind this project, which will have the positive benefits that my right honourable friend so eloquently sets out.
We're heading up to Linlithgow to Martin Day, the SNP spokesperson. Martin Day.
Thank you, Mr. Speaker. Yesterday, we heard the Prime Minister describe his Operation Moonshot as the only hope of avoiding a second national lockdown. Already, some experts have described this mass testing strategy as being fundamentally flawed. So does the Secretary of State think the Prime Minister is gambling on something that the experts feel cannot be delivered? On Tuesday, the Secretary of State failed to answer my honourable friend, the member for Central Ayrshire, when she asked if it would be better to allow tests to be carried out locally and just move the samples around the UK instead of potentially infectious people. As he didn't give an answer then, will he consider this now? And finally, will he join me in welcoming the launch of Scotland's Protect Scotland mobile tracing app yesterday? And what update can he give the House on his own government's plans to release a similar app?
Very much, Mr. Speaker. We've been working with the Scottish Government as well as with the Welsh Government and the Northern Ireland Government and actually governments internationally on an update on the app technology. On the second point that he makes, it's simply a mischaracterisation of the policy. Of course we move samples around the country all of the time. What we want to do is, of course, continue to reduce the amount of distance people have to travel. And as I say, the average distance people have to travel to get a test is 6.4 miles. But I come finally to the first point that he made. Because there were, in the spring, some people who complained about my determination to expand our testing capacity at a record pace. We're hearing some of those voices out this morning, again, complaining that we want to increase testing. The party, both the SNP and the Labour Party opposite, are making a huge mistake in opposing mass testing. It is an incredibly important tool in our arsenal.
Thank you, Mr. Speaker. My right honourable friend is a great supporter of the UK's businesses and entrepreneurs. In his measures to tackle the virus, can he intercede with his public health colleagues to prioritise the businesses that generate economic growth so that when this is over, we have an economy that's prosperous enough to cash the very generous cheques that we've written?
Well, my honourable friend is absolutely right and speaks with great knowledge, experience and eloquence on this matter. We have to protect livelihoods as much as is possible in the same way that we're trying to protect education as much as is possible. That does mean sometimes we have to take measures that people would prefer not to see on social contact, but unfortunately the measures that the Prime Minister outlined yesterday that I set out in my statement are, in my judgment, absolutely necessary, both to keeping the virus under control and to protecting education and the economy as much as is possible.
Very.
Thank you, Mr. Speaker. There's been a significant increase in COVID cases confirmed in Liverpool in the last week, with widespread community transmission. Yet I've been contacted by constituents with symptoms who are trying to book a test and either can't or are being told to go to Oldham, to Manchester, to Powys, to Colwyn Bay, when there's a testing facility in Liverpool Airport just down the road in the constituency. So can the Secretary of State explain why this is and why there's no availability of home test kits, given there appears to be so much unused testing capacity?
There's, as I said in my statement, there's record testing capacity and most people get tests very close to home. However, we have got this challenge that some people without symptoms who are not eligible for a test have been coming forward. Thus far, I've been reluctant to put a barrier and a strong eligibility check on the front of the testing system because I want people with symptoms to be able to get that test as fast and easily as possible. However, with this very sharp rise we've seen in the last couple of weeks of people coming forward for tests when they are not eligible, that is something that we're having to look at. The key message to her constituents is that these tests are absolutely vital for people who have symptoms, and therefore, if you don't have symptoms and haven't been told by a clinician or by a local authority to get a test, then you should not and must not go and use a test that somebody else who needs it should be using.
I understand the recent actions my right honourable friend has taken to limit gatherings to 6 people, and I would encourage everyone in West Bromwich East and the wider West Midlands to follow the new rules. However, does he agree with me that West Bromwich should remain separate from any local lockdown in central Birmingham, given they are 2 distinct areas with varying rates of infection?
Well, of course, West Brom is a distinct area and separate, of course, in its geography from central Birmingham. However, I would caution my honourable friend that we are seeing some sharp rises in cases across many parts of the West Midlands. And so we do take these decisions on a localised basis. We do not take a whole local authority or regional geography in one go, but we do follow the data, and I'll be sure to keep in touch with my honourable friend. She is a very strong advocate for her local area, but sometimes action is necessary.
Okay. Can I first of all thank the Secretary of State for the new test centre in Wythenshawe Town Centre that opened this week. Can I challenge him though on the consistency of governance around his department? In Greater Manchester, the MEN are reporting that Bolton has been subject to 4 sets of rule changes in the past fortnight. ITV are saying that 74 local authorities have a higher infection rate now than Greater Manchester had before it went into lockdown. Last week, my constituency of Wythenshawe and Sale East that straddles Manchester and Trafford would have been split asunder hadn't the department U-turned. Restrictions in Greater Manchester are not working because infection rates are mushroomed. What is next, Secretary of State?
I've been in contact with the Mayor of Greater Manchester this morning on the question of what we do in Greater Manchester. Of course, the national measures that were announced yesterday will come into force in Greater Manchester. It's very important that people follow them. We took further action in Bolton. The case rate in Bolton was coming down very well, and thankfully, before we implemented the rule change to remove some of the restrictions, we were able to act and stop that relaxation from happening, and in fact then had to tighten up. And so I'm working very closely with the councils in Greater Manchester and with and talking to the mayor, and I'll absolutely take on board his views as well in making sure that we get the measures right. The message to everyone in Greater Manchester is the same as across the country: follow the rules and follow the social distancing, because it's only by doing that that we'll get this under control.
We go to Chair of the Science Committee, Greg Clough.
Thank you very much, Mr. Speaker. The Secretary of State must accept that there is a problem here. Constituents of mine in Kent this week, displaying symptoms of COVID, were advised to go for tests to Bude in Cornwall and Galashiels in Scotland. And this is in a mild September, before the autumn and winter, when people have coughs and colds that may look like symptoms of COVID. And it's no good blaming people who are asymptomatic. I'd be interested if the Secretary of State can say what percentage of people are turning up for testing that don't have symptoms. I think this needs his personal grip. He referred to the need for him to increase testing capacity from 1,000 a day to 100,000 a day. This is an urgent matter. It needs a grip before the autumn bites, the autumn-winter bites. Will he commit by the end of the month to make sure that anyone that has symptoms of COVID can get a test at a reasonable place convenient to their home?
That is, of course, my goal. It's my goal for that to happen immediately. And the challenge is both to increase the capacity, a subject that my Roger and I have discussed at length, and I know he's a strong supporter of. It's also a matter of making sure that capacity is used by the right people. And this is why I am clear about the eligibility for testing. And it's really important that people hear that message, that if you have symptoms, of course, you should get a test. We urge you to get a test because we need to find out if that is COVID for your sake and for everybody's. But at the same time, it is important that people who are not eligible do not come forward for those tests, because otherwise you're taking a test away from somebody who has symptoms. And yes, absolutely, the best, I want to solve this with ever more capacity, but I also want to make sure the tests are used by the right people.
We go to Manchester to Afzal Khan. Thank you, Madam Deputy Speaker. Many of my constituents are incredibly anxious about schools reopening and want to send their children off to school in the knowledge that they are safe. I'm sure the Health Secretary agrees that keeping schools open safely requires a testing infrastructure that is fit for purpose. So can he explain to the House why each school has been provided with only 10 testing kits?
We have very strong protocols on the return to school, and I'm really glad at the success of the policy to get all of the schools back. I would say that's one of the unsung successes of the government over recent weeks, and that is working effectively. The guidelines set out very clearly when testing is appropriate. Again, testing is appropriate for people who have symptoms. Close contacts of people who have symptoms need to self-isolate, not to get a test unless they themselves have symptoms. And the reason for that is because if they got a test, it wouldn't allow them to leave self-isolation anyway because of the risk of false negatives. So that's why we have the policy as it is. We have given each school 10 or more tests so that they can easily use them if in an emergency. And that's been warmly welcomed, I know, by most schools.
Laura Ferris.
Madam Deputy Speaker, a successful return to school in West Berkshire has been matched with a reduction in the availability of testing. I've listened to my right honourable friend this morning, and if there is a reluctance to impose more stringent eligibility criteria, would he consider an order of priority based on, for example, working parents, teachers being able to access tests sooner?
Again, there hasn't been a reduction in capacity in Berkshire or anywhere else in the country. There's been an increase in capacity. She makes a very good point, though, about the prioritisation. The question is how to enforce a prioritisation without putting in place barriers that slow down access to tests for people that need them. And that's something that we're looking at now.